Hello, I'm Debora, an associate project manager here at BAP Pharma. I work in the managed access team where we focus on early access pathways for patients such as named patient and compassionate use programs. So, as part of EDS and HSD Awareness Month, I'm joined today by Scarlett from the Ehlers-Danlos Society. And today we'll be kind of talking through what the syndromes are, the kind of symptoms that come along with them, the challenges around diagnosis, and what the current approaches are to treatment and awareness. So, Scarlett, I'll let you introduce yourself.
Hi, my name is Scarlett Eagle, and I'm the Community Education Manager at the Ehlers-Danlos Society, where I focus on creating educational resources about EDS and HSD for a variety of platforms. And I'm very happy to be joining Debora here today.
So, to start us off, what is Ehlers-Danlos syndrome and hypermobility spectrum disorder? Can you tell us a little bit more about what life is like for people with EDS and HSD?
Absolutely. So the Ehlers-Danlos syndromes, or EDS, are a group of 13 heritable connective tissue disorders. Each type has its own features and diagnostic criteria, but they're generally associated with joint hypermobility, skin hyperextensibility, and tissue fragility. Now, the hypermobility spectrum disorders, or HSD, are diagnosed when someone has symptomatic joint hypermobility that cannot be explained by other conditions. Now, people with HSD experience many of the same symptoms and challenges as seen in hypermobile EDS. And both EDS and HSD can affect multiple systems throughout the body, so people may experience a wide range of symptoms that can vary significantly from person to person and over time. Because of this variability, people's experiences can look quite different, and this can make recognition and diagnosis more difficult.
Thank you, Scarlett. That was great. I guess it's kind of clear that EDS and HSD can affect people very differently, and I think that leads us quite nicely into the question of diagnosis. So, why are diagnosis delays so common, and what kind of impact does that have on its community members?
Yes, unfortunately, diagnostic delays are common, with research suggesting that it can take an average of 10 to 20 years to get diagnosed with EDS or HSD. One reason is that these conditions can affect multiple body systems, and symptoms may not appear connected at first. There's also still limited awareness of EDS and HSD among healthcare professionals, which can make it difficult to recognize the patterns. These delays can have a real impact on our community, with many people reporting challenges accessing appropriate care and navigating healthcare systems before diagnosis. Earlier recognition can help people access the care that they need much sooner.
Well, I guess just hearing the 10 to 20 years to receive a diagnosis, I really can't begin to imagine how frustrating that must be for community members. But Scarlett, once a diagnosis is actually reached, could you tell us a little bit more about what treatment options community members currently have as an option?
Absolutely. Community members with EDS and HSD actually have a range of options available to manage their condition, depending on the symptoms and any specific risks associated with their type. Now, this can include medications, pain management, movement-based approaches, supports, adaptations, and monitoring and addressing any associated conditions or potential risks. In most cases, people use a combination of strategies using a multidisciplinary care team with approaches tailored to their individual needs to manage their specific symptoms.
So, no necessarily specific treatments or necessarily a cure for it, but just managing those symptoms. Would you say that there are any barriers currently at the moment that members face in accessing treatments? Treatments, in terms of standard care and even more innovative treatments in clinical trials or early access pathways?
Yeah, I think there are several barriers to accessing care for people with EDS and HSD. This includes limited awareness of healthcare professionals, limited access to knowledgeable healthcare professionals, and also limited coordination across healthcare specialties because we've talked about how these conditions can affect systems throughout the body. Additionally, some medications or approaches may not be approved for EDS or HSD, even though they can help with specific symptoms that people experience. Awareness of alternative pathways like early access programs is also quite still limited within our community. Now, I'd like to turn to you, Debora, to ask what's being done to increase access.
So yeah, I do think that there is a growing focus on trying to better understand where the gaps are in access, especially for conditions where treatment options are limited, like EDS and HSD. So at the Operationalize EAP conference last year, it was really encouraging to see that the Ehlers-Danlos Society was there engaging with pharmaceutical companies around the idea of possibly repurposing existing therapies to help with the different symptoms that you mentioned and the kind of management around those symptoms. So I think that is a really positive step forward for improving access, specifically within the EDS and HSD space, just that constant engagement with pharmaceutical companies. But from our side at BAP Pharma, what we do day in and day out is really support access through pathways like named patient and compassionate use programs. So we help clinicians explore options outside of those standard routes of treatments in the most kind of compliant and streamlined way possible to kind of make it as easy as can be for clinicians to engage in these pathways. A big part of this support is really through awareness building. So making sure that clinicians and patients know and really understand that these pathways exist and when they might be appropriate in each specific scenario. And I think there's definitely been a lot of progress within this awareness, but there's always more to be done. And engaging with patient advocacy groups like Ehlers-Danlos Society has really helped us on this mission of educating people on EAPs within the different communities in the space. So Scarlett, since we're always trying to improve, from your perspective, how well do clinicians and community members currently understand early access pathways?
Yeah, that's a great question. I think awareness of early access pathways among community members is generally quite limited. I think many people are so focused on navigating diagnosis and day-to-day management that they may not even be aware that these pathways exist or how they work. There can also be challenges in understanding when they're appropriate, how to access them, and what role healthcare professionals play. So I think clear and accessible information is really important so people can better understand these pathways and explore them when appropriate.
Yeah, I definitely agree with everything you've said. I would say exactly similar to what you mentioned, awareness really varies across clinicians. And from discussions with different patient groups, we often hear that the patients themselves are the ones bringing these options forward and advocating for their own treatment. Of course, in more specialized centers, clinicians may be a bit more familiar with early access pathways and how they can be used, but in a lot of the other settings, awareness is still quite low, and these pathways may not always be considered as part of the treatment journey for all the patients that it could be. Like you mentioned, there can also be a lot of uncertainty around how to access them, what the process involves, and what kind of support is available if a patient does decide to go through this route. And that's where BAP really support the most in trying to break down those steps as much as possible and try to make it as easy to kind of navigate as we can. We work closely with patient groups as well to develop really clear and easy to understand early access guides and toolkits. So sometimes it's as simple as a toolkit, questions to ask your doctor checklist that patients can bring along with them on consultations to really understand and go run through whether early access might be an option for them. That's one of the ways that we at BAP try to increase awareness of these pathways within the work that we do. But we're always looking to improve as well, like I mentioned. So what would you think needs to be done to improve awareness of early access within your space and your community members and within the space with clinicians as well?
I think improving awareness about early access pathways will really require coordinated efforts across multiple groups of stakeholders. For community members, that means clear, accessible information about what these pathways are, when they may be relevant, and how to start conversations with healthcare professionals. For clinicians, it's more about knowing that these pathways exist and understanding how to navigate them. So I think continued collaboration between researchers, healthcare professionals, patient advocacy organizations, and industry is essential to improving access to appropriate care and emerging options when available.
Yes, I agree. I agree completely. I think building on that, one of the key things really is making this information more practical and easier to apply in real world settings. So for clinicians, it's not just about knowing that they exist, but really understanding when to consider them and how to navigate the process if they do decide to go down that route with a patient. And for patients, I think it's about making them feel confident enough to ask those questions and know what to look out for during conversations with their healthcare providers. So from what we see, I guess sometimes it's even the small things like clearer guidance or simplifying a lot of the medical jargon that is used a lot of the times. It can really make a big difference in how these pathways are used and how they're understood. And ultimately, exactly what you said, I feel like nail on the head with that one. Continued collaborations between all the organizations like Ehlers-Danlos Society, clinicians and access providers like ourselves, BAP Pharma, is really key to making it happen in practice. But thank you so much, Scarlett, for joining me today. Thank you. I think it's been a really great conversation. Thank you so much for your time. And I hope we can continue this conversation and build on this work going forward as well.
Definitely. Thank you so much, Debora.